Thousands of dollars in COVID funding for child care facilities is expiring at the end of this month. It's money that those centers need to keep the doors open. Good evening, everyone. I'm Amanda Hill.
And I'm Brian Yacono. Daycare centers are not only struggling now to pay the staff they have a competitive wage, they are also finding it hard to find qualified candidates to fill their vacant positions there. In fact, earlier this month, the owner of a center in Caribou that cared for nearly 100 children had to close because she said, quote, "It is impossible to continue operating a business with extreme overhead that does not match what is being brought in by tuition."
Now that money is set to go away, and teachers worry fewer families will have child care options, either because a facility closes or becomes too expensive.
The business of caring for small kids is facing a giant problem.
A lot of people are trying to decide, is this worth going to work for?
Laura Larson has been working at this facility in Brunswick for 18 years.
Are you saying I'm awake now?
She's been relying on COVID-era funding to keep both her staff and families happy.
That kept places alive if it wasn't for that money.
Federal funds that are still keeping her staff's salaries up and families' costs down.
Most everybody that I know of used that money to increase our wages so we can keep our workers.
The state gave that federal money, called transition grants, to facilities based on how many kids they could care for under their licenses. It started at $100 per kid in October of 2022 and slowly phased down to now $25 per kid. Maine's Department of Health and Human Services says 86% of eligible child cares took advantage of these grants.
So the true cost of care and what we can actually charge families is completely different. So the cost of care has gone up because I have to pay the workforce more to compete with the other job industries and job markets.
It's that pinch of, what's that fine line of what families can afford to what programs can operate on, and this has always been broken.
Laura's facility charges more than $300 per week for infants and more than $260 per week for preschool.
I mean, some of these families are paying as much as their mortgages. You shouldn't be paying 30% of your income for childcare or 40% of your income for childcare just so that you can get in your car and go to work.
We understand there needs to be public investments to make that business model better for early childhood programs and for the whole economy. We need childcare so that folks can get to work.
A dangerous domino effect. Stay home to save on childcare, but not go to work. Parents and providers stuck between a cot and a hard place.
Parents can't pay more, but if I can't pay my staff more, they're going to be out of care one way or the other. Either they're not going to get it because they can't afford it, or they're not going to get it because I can't keep the workers.
Chris Costa reporting. The state is conducting a cost of care survey to see what families pay for and what expenses facilities have. Senate President Troy Jackson says he is planning to introduce a bill next session to help providers who use subsidy to care for low-income families. It would be based on subsidy family enrollment, not attendance, which he says should provide some stability.